I watched the David Dimbleby show on Thursday night, the 27th of October 16. And there was a man there by the name of Ken Loach, who is a film director. And I can confirm that everything Ken Loach said on that show was a fact. These assessments are terrible. Although I've just won an appeal on behalf of a young man, and the paperwork itself that they receive, and then have to wait 9 weeks before they get an answer to the assessment. And on his, he was completely taken off the scare component. And then I asked them to reconsider and sent them reasons why. And I got a call from the lady who did his case, telling me that the rest of the statement I had sent to them, she didn't realise that his situation was as bad. And the case was then going to be given to her case manager, who may overrule her decision. But she, at the end of her conversation, she did say, I probably wouldn't have to appeal. However, the case manager sent back saying that the decision still held. And so I appealed to Her Majesty's appeal courts on regards to what had happened. Well, to cut it short, I won my statement that I sent to the appeal panel. I won the case and won the appeal. However, these assessments, they're not done. What Ken Loach said about these assessments regarding the people who deal with the assessments, they're not professionals. Psychiatrists and doctors, etc., are the people who should decide whether a man is entitled to benefits or whether he isn't. It shouldn't be left to people who don't know anything about what the person is suffering from. They're called healthcare professionals, but as Ken Loach said, they're not professionals. They haven't gone through university or any sort of. They are, as he said, they are told by the government how to deal with these cases, and that's how they have to deal with them. No disrespect to those who are employed in doing that, but they are advised on how to deal with these things. And I attended this assessment with the lad, and he agreed that he was able physically to do the daily tasks that he was asked about. I knew that he needed prompting to do these tasks because of his mental health situation. And that is what I appealed on and eventually won for him. But there are young people who are afraid to go to these assessments, although they are entitled to the benefits. The paperwork they get, the time they have to wait, etc. You have to understand the illness that these people suffer from, that there's a lot of fear attached to the illness that my lad suffers from. It's called obsessional compulsive disorder. I tried 2 private hospitals to take him in for 1 week until I'd dealt with something else at approximately £4,000 a week. And the first general hospital in Ayrshire said they didn't have the amenities for OCD, but gave me a telephone number of a psychiatric hospital in the same street they were in. And when I phoned them, they said they didn't have the security for OCD. So it seems it's fear on both sides, the psychiatric side and the patient side, because the OCD is based on fear, and fear of people wanting to do them harm, etc. But I won't go into all that. I have studied it for years and also watched this young man suffering, trying his best to find a cure, get the right things. Although he turned to alcohol and what they call legal highs, legal drugs I call them. They're now finished with, and I campaigned with the Minister of State at the Home Office regarding those drugs because they were killing young people. 68 died between the year 13 and 14, and more died in 15 with those drugs. And I think it was irresponsible of anyone ever given licenses to sell those drugs for shops and the internet to be involved in those drugs. Anyway, these assessments, Ken Loach, I heard on that show, had made a film called I, Daniel Blake. Now, I went into Glasgow and asked around, and I found there was a cinema in Glasgow showing this film, and I went to see it. And I can say, whether it was a true story or not, the facts were true. Ken Loach had it right, and the facts of that case, because what is happening in that film is happening all over Britain with these assessments, and what happens at the unemployment exchanges, etc. And the staff at these places are not to blame. It's they have to carry out the rules that are laid down for them, and Ken Loach agreed with that as well at that show. But he portrayed a man, Daniel Blake, and how he had worked all through his life, and when he took a heart attack, he was put off work and had to he got benefits to start with, but these benefits on assessments were taken away from him, and he had terrible difficulties trying to get any kind of money at all, and eventually at an appeal he died. And this is a true picture of what's happening because of these benefits being taken away from people who are really ill. I would never appeal or go to a medical with anybody who was fiddling the system. And I know for a fact that there are many young people who don't even go to the medicals or the assessment because of a fear that they maybe get into trouble or something. But in actual fact, they are entitled to benefits because of what they're suffering from. I don't know what is happening to the mental health system at the moment, because I'm watching on television that it seems to be in a crisis, that people are dying who are unexpected deaths, in the mental health system. And this all started in 1993 when the government closed down the mental health hospitals and they were put in among the community. Now, I don't blame the community because many of them had serious illnesses and neighbours, they had living beside neighbours, or many were homeless and still are. One old man said to me at Brentford Mental Hospital in 1993, he said, "Have you come to help us?" And I said, "Help you with what?" And he said, "That woman is putting us out and among the community. This is my home. I don't want to go in among the community." He called them through. He said, in actual fact, he said that she's putting us out among all those other fruit and nutcases. And anyway, I told him I would do what I could, and I have spoken to MPs. I have done quite a bit in trying to show MPs, psychiatrists, etc., that it was a big mistake to close those hospitals. And I think if you look at the mental health system today, that is the result of those hospitals being closed. However, Theresa May has said she's going to stop these assessments, according to what I listened to at that David Dimbleby show. But why is it going on today, now, at this very moment? If they can take off their clothes and put them on, they're losing their care component. Take a shower, etc., shave and all the rest of it, speak to people. Well, that's physically my young man could do that, but mentally he had to be prompted all the time to take a shower, to shave and get his hair cut, etc. And that is why I won his appeal. But these assessments, I just can't see where one MP said, I think it was Tory MP, said that it was designed to help the patients that were on benefits. But I can't see where he gets that from, because this particular assessment at the moment is definitely designed to take benefits away from their care components. And you don't only lose the care component from PIP, you also lose it from DWP, if you're getting one from there, which comes to quite a bit of money. But Ken Loach he has made many films about the poor, etc., I believe, and he has it right with his film. The facts that he has, whether it's a story to show the facts or not, I don't know, or whether it's a true story. Daniel Blake may be a person who went through what happened. However, what he has portrayed is happening all over Britain. There are people being put off benefits that shouldn't be put off them. Some of them don't go to these assessments, etc., because their minds are not able to cope with things like that. And my young friend is lucky that he has got someone to support him and to represent him at these things. And but there is many young people who just stay in their home and very rarely go out and that sort of thing. And OCD, which my young man suffers from, is based on fear fear that people will attack them and sort of they won't open doors to people who knock on the door, etc. So they're entitled to these benefits because they need them to survive and because they can't work. And Theresa May also said that she would speak to anyone who had a grievance against her government, and no matter what their position was in life. Well, my position is that I left school at 14 years of age, and through life experiences I have gathered a lot of knowledge about life and the way some people have to live it. And I have rubbed shoulders with the poor and the alcoholics and the prostitution, and I've also rubbed shoulders with the rich. I even have rubbed shoulders with Maggie Thatcher, for instance. But that was 2 years before she became the Prime Minister in 1977. And she became Prime Minister in 1979, I believe. However, I would love the opportunity to address any politicians who feel that what they are doing is correct. I would love the opportunity to go in front of the television studios with any politician and see what they do know about what these people are suffering from. So if Theresa May would listen to me, I would love the opportunity of speaking to her, because in my opinion, what is happening today in the mental health system is because of the closure of those hospitals in 1993. Thank you for listening, and God bless you all.